Hi, my name is Dr. Satish Tadepalli, and I work in two locations. One is in Hamilton, and other location is Kilmet, New Jersey. I grew up in India, where I did my med school, and I came to USA. I did a master's in public health. I did a residence in internal medicine, and then I pursued venous and lymphatic medicine fellowship to become a vein doctor. It was a great experience. It was a big learning curve. As an internal medicine doctor, I was not big with procedures, but vein medicine is all about ultrasound scan and procedures, and it was a big learning curve, but it was very what you call fascinating and interesting. And I had a very good mentor, Dr. Pappas. He's the best. So as an internal medicine doctor, I was not much aware about the vein care. I mean, I used to see patients with having this edema, pain, swelling, heaviness, all the symptoms of vein disease, but not many vein or you call vascular surgeons were treating this venous disease. It was like something which was not given much of attention from when I was doing my residency. But slow and gradually, when I started learning that there are a lot more patients can get and all the procedures, how much symptomatic relief they can get from this procedure, that was a game changer. And it's very interesting for me because like right from my medical med school, I was always into cardiovascular medicine, and this was very close to what I wanted to do. So CVI is one of the biggest organizations in vein practice, and they're spread everywhere, and they're very flexible, they're very friendly, and I could choose where I want to go. I can even uh, the staff is very friendly, they're well trained. I mean, everything is so well organized. So it's very naturally I picked the company uh, which is something which I can fit in easily. So from a patient care is something like whenever I treat a patient, I'm making sure the patient I understand, I listen to them. That's the most important thing I always pay attention to. Listening to the patient and addressing their question and explaining to them in a what do you call about their vein disease and procedures which can be done to relieve their symptoms. And end of the day, I want the patients to leave the office with a smile. And end of the treatment, I want to be happy with what I've done. Otherwise, there's no point for me treating them. If the smile is what drives me, gives me the strength or what you call the driving force. So, as a doctor who has what you call skills in doing a vein treatment, so I can do radio frequency ablation. I can do laser treatments. I'm even trained to do venous seal, where I'm injecting a gel into the vein to close the vein. And I do microstap phlebectomy, where I do a small incisions to pull what you call to plug those bulgy veins. And I am trained to even to do what you call as a physician guided ultrasound foam sclerotherapy and varicina. I even take care of venous leg ulcers, lymphedema, lipedema. I even do Una boots for ulcers as needed. My role is to explaining the patient, tell them what was going on with them and the treatment options available. Sometimes I let them pick whatever they want, the procedures they prefer. And end of the day, my role is like most I'm like a guide, and I'm like a guide telling them and try to be as friendly as possible so that they understand the treatment and the smooth journey for the patient. So I want my patients to know that I care about them, and I have done procedures like hundreds of times. So I know what I'm doing, and the best thing is I'm really good at what I do, and I had good patient outcomes so far, so they can trust me, and I in a kind of guarantee that they will be happy.